Who's the dumbest person you've ever met? My college roommate's boyfriend, Tyler, who tried to convince everyone that nurses were just failed doctors and that he could do their job better because he watched Grey's Anatomy. Tyler was a business major who'd never taken a single science class but acted like he was a medical expert. His girlfriend Emma was studying nursing, working her butt off through clinical rotations and studying for boards. One night, Emma came home exhausted after a 12-hour shift at the hospital. She'd been running between patients, administering medications, and helping doctors with procedures. Tyler looked up from his PlayStation and said, "Must be nice having such an easy job." Emma stared at him. "Easy? I was on my feet for 12 hours straight taking care of critically ill patients." Tyler shrugged. "Come on, you're basically just following orders. The doctors do all the real thinking. You just hand them tools and take temperatures. I was doing homework at the kitchen table, trying to mind my own business. But this guy's ignorance was painful to witness." Emma tried explaining the complexity of nursing care, medication management, patient assessment skills. Tyler interrupted her. "Babe, I've seen every episode of Grey's Anatomy twice. I know what nurses do. They mostly just stand around looking pretty while the doctors save lives." That's when I looked up from my textbook. "Tyler, have you ever actually been inside a hospital?" He rolled his eyes. "I've been to the ER plenty of times. Broken my arm twice, got stitches once. Trust me, nurses just write stuff down and ask if you're in pain." Emma pulled out her phone and showed him photos from her clinical rotation. "This is me inserting a catheter. This is me starting an IV on a 90-year-old with rolling veins. This is me calculating medication dosages based on patient weight and kidney function." Tyler barely glanced at the photos. "That stuff looks easy. I could probably do it better than most nurses. How hard is it to stick a needle in someone's arm?" The next day, Tyler announced he was going to prove his point. He'd asked Emma to teach him some basic nursing skills to show how simple they really were. Emma, probably exhausted from arguing, agreed to demonstrate blood pressure monitoring. She brought out her practice equipment from school, the manual cuff and stethoscope. Tyler put on the cuff and immediately started pumping it up without positioning the stethoscope properly. "Just pump it up until it's tight, right?" He inflated the cuff so much that Emma had to stop him before he cut off circulation to her arm. Then he couldn't hear any sounds through the stethoscope because he'd placed it completely wrong. After 10 minutes of fumbling around, he declared the equipment was broken. "This is stupid. In real hospitals, they probably have machines that do this automatically." Emma patiently explained that even with automated equipment, nurses need to understand the principles and troubleshoot when machines malfunction. Tyler's confidence wasn't shaken. "Whatever, give me something harder." Emma brought out her medication calculation worksheets. Basic math problems about drug dosages based on patient weight and concentration. Tyler looked at the first problem for about 30 seconds before giving up. "This is just trick questions designed to make nurses feel important. In real life, they probably just ask the doctor what to give." That's when Emma finally snapped. "Tyler, if I give the wrong medication or wrong dose, people die. This isn't a TV show. These are real skills that take years to master." But Tyler wasn't done demonstrating his ignorance. At a party that weekend, he cornered a nursing student from another school and started explaining how nursing was basically playing doctor, and that anyone with common sense could do it. The nursing student listened politely, then asked, "So you think you could manage a patient with sepsis while titrating multiple IV drips, monitoring for adverse reactions, and coordinating care with 5 different specialists?" Tyler nodded confidently. "Probably. It's just about paying attention and following directions, right?" The nursing student just smiled and walked away. Emma broke up with Tyler a month later when he suggested she switch majors to something more suitable for women, like elementary education. His reasoning? "Teaching is basically just advanced babysitting, which you're probably better at than pretending to be a doctor." Last I heard, Tyler was working at his dad's car dealership, still convinced that most professions are way easier than they look, and that he could probably do anyone's job better than they can. Emma graduated nursing school with honors and now works in the ICU, literally saving lives every day. Sometimes the dumbest people are the ones who think everyone else's expertise is just common sense.
Check out this story. You will like it for sure.